Good morning, everybody. Today we'll be discussing about applications of dual energy CT. So first one is vascular and cardiac imaging. In vascular and cardiac imaging, one is bone and plaque removal. What this does, it selectively subtracts calcium to clearly visualize the blood vessels, which is especially useful in brain and lower limb angiography. Another is myocardial perfusion. It detects the perfusion defects, that is the areas of ischemia or old infarcts, more conspicuously than the conventional CT. So in vascular and cardiac imaging, one is for bone and plaque removal, so that we can see the blood vessels clearly, especially in brain and lower limb angiography. Another is myocardial perfusion. It detects the perfusion defects more than the conventional CT. Another is pulmonary embolism. It creates iodine maps that highlight the perfusion defects in the lung parenchyma, improving the detection of small peripheral emboli. So in vascular and cardiac imaging, it's useful in bone and plaque removal to see the blood vessels. Myocardial perfusion, detect the perfusion defects. Pulmonary embolism, for detection of small peripheral emboli, it creates iodine maps. Another is abdominal imaging. In abdominal imaging, kidney stone characterization. Differentiation between uric acid stones, which can be treated with medication, and non-uric acid stones, which can require surgical intervention. Another is incidental lesion characterization. Differentiates hypertense renal cysts from enhancing solid tumors by identifying the presence or absence of iodine. So one is for kidney stone characterization, uric acid or non-uric acid. Another is lesion characterization, whether it is a cyst or a tumor. In bubble ischemia, it enhances the visualization of decreased bubble wall enhancement to identify early ischemia or necrosis in the cases of acute abdomen. So it enhances the visualization of decreased bubble wall enhancement for early detection of ischemia or necrosis in cases of acute abdomen. So for abdominal imaging, kidney stone characterization, uric acid or non-uric acid, whether it's a cyst or solid tumor, whether bubble wall necrosis, early diagnosis of ischemia or necrosis, decreased bubble wall enhancement, it enhances. We can see it clearly. Musculoskeletal imaging, gout diagnosis, especially it identifies monosodium urate crystals in the joints and tendons, and it color codes them as green to differentiate them from the calcium deposits. Bone marrow edema, virtually it subtracts calcium to reveal the marrow edema, a biomarker for occult fractures that typically requires MRI. So in musculoskeletal gout diagnosis, specially identified monosodium urate crystals. So it color code them